Welcome to Epoch News. I'm Tatiana Darzi. As of this morning, CCP virus infection cases have increased to over 2 million cases worldwide. The 6 most affected countries suffering from the pandemic are Turkey with 69,392 cases, the UK with 98,476 cases, France with 106,206 cases, Germany with 130,450 cases, Italy with 165,155 cases, and Spain with 177,633 cases of infection. This is not including China or Iran because the number of cases of infection in those countries are unverifiable. Yesterday in the United States, there were 609,516 cases of infection, and as of today, there are 639,664 cases in the country. That's about a 30,000 increase in the number of cases. Today, in New York State, there are 213,779 people infected with the virus. Let's take a look at New York State's number of cases in the last 7 days. On the 13th, there were 6,337 reported cases of infection, the lowest we've seen this week. On April 14th, there was an increased number of cases which came to 7,177, and yesterday it increased to 11,571 reported cases. Mayor Bill de Blasio announced yesterday that supply chains will produce 50,000 coronavirus test kits every week for New York City.
Face shields, surgical gowns were never, in recent memory, made in New York City. These are brand new production lines created from scratch by companies here, by New York City workers, in an atmosphere crisis, and they've surpassed any possible expectation we could have, and they're going farther. We want to make sure we're secure for the future. We want to someday move off that crisis standard and go higher to an even better standard. But so long as we're in the middle of this war, so long as we're fighting the coronavirus in the kind of crisis dynamics we are in now, for the first time with something as important as face shields, one of the major PPEs, we're going to be able to say we are self-sufficient. New York City will be self-sufficient. We will no longer be at the whim of either the federal government, the international markets. We won't have to import things from overseas. We will be self-sufficient. It just is not safe to bring back our schools until we are absolutely certain that we have moved out of this crisis. You know, we're talking about places where you bring together a lot of people, and the safety and health of our kids, our parents, our families, our educators, that's what we should be focusing on in making every decision we make. And it certainly was paramount in why the Chancellor and I decided to keep our schools closed for this school year.
People were clapping and cheering nurses from all over the country who traveled to New York City. These nurses came to help relieve some of the local staff's current workload and also to help provide much-needed medical care to those in need. The selfless act of leaving the safety of their homes, leaving their families and loved ones in order to help people miles away in another state is very moving, to say the least.
2020 is the year of the nurse. We didn't expect to be celebrating it in this way, but it is so heartwarming to see so many nurses come from so far away to assist us in this time of need. Without these resources, I don't know what kind of state we would be in, but this is something that we have been preparing for several weeks, at least actually several months, in looking at what our needs would be and what the volumes of patients would be within all of our hospitals. Certainly the outpouring of love and caring and support that we have received from numerous communities, but most especially from the medical community, physicians and nurses and nurse practitioners and physicians assistants, is just heartwarming and really helps to keep us motivated, keep us buoyed up, keep us going on for the next day to care for the next patient. It is our hope that this will end as soon as possible, but it is actually, as I said, it is very rewarding to see so many people from around the country supporting us, not just in their words and their deeds, but in coming to assist us during this time.
Where I'm from, our hours have kind of been cut back. Our hospitals are not empty, but basically bare bones. And so we haven't been working as much. I've been sitting at home and I know I have these ICU skills and know how to manage the drips and the vent and whatnot, and felt silly kind of staying at home and not putting those skills to use. So that's why I came up here, and I'm really excited. This is a great team, and I'm happy to be relieving these nurses who have been working crazy hours and really putting themselves in harm's way, and but also for the patients.
Thank you so much.
And speaking of selfless acts, several people in the Bedford-Stuyvesant neighborhood in Brooklyn have opened a mobile market to give out fresh produce and bags of assorted foods to families and those in need. They usually feed up to 600 families a day. Take a look.
We're distributing food at our mobile market. Typically, this market started with us giving out fresh produce, and now sometimes we give out emergency food. So right now we're doing both. We're giving people a box of produce, assorted produce, and a bag of assorted pantry items, cereal, milk, salmon, chicken, and tuna. We feel that by us giving out this food, some of the stuff is really desirable to people, like the shelf-stable milk especially, because we never know if we're ever going to lose power. So people are very grateful to be able to get here. And, you know, we don't have lines. We usually have very long lines, but we're starting earlier to be able to avoid having crowds. So far it's going great. People are being able to keep their distance. It's a little complicated for some people to stay away from each other because they're neighbors, they know each other forever. So, you know, they kind of feel safe. But we tried to tell them that they have to back up and they have to keep their distance. In a mobile market, daily, we're feeding about 350 to 600 families.
It's never easy being a healthcare provider, especially during times of uncertainty. Medical personnel share some of the hardest moments they've experienced during their shifts while fighting the CCP virus pandemic. While on the front line of this battle, they witness firsthand what patients and their families go through. Some could be seen fighting back tears while recounting their heartbreaking experiences in front of the camera.
I'd say the hardest moment was having to put a breathing tube in my patient who could no longer breathe for herself. And after the breathing tube went in, we called the family, and the husband, of course, couldn't visit her because of visitor restrictions at the hospital. So I had to put him on a phone and hold the phone to her ear as he told her that he loved her so much. And then I had to wipe away her tears because she was crying.
Of the hardest moments was having to see a family member of a COVID patient say goodbye over an iPad rooms away. That was a tough one. I can't imagine how hard it would be to be saying goodbye and you can't see your loved one and then they're gone.
It's hard. It's hard in lots of ways. Since it's a new virus, we don't have any experience with it. For most diseases, I'm used to seeing it and taking care of it, and this, I don't have any starting place. I know what I'm hearing from New York. I've read all of the papers, it seems like, but no one knows what the correct answers are, so there's a huge amount of uncertainty, and people are really, really sick.
I had a patient fall out of bed today, and I had to call his wife and tell her, and she couldn't come see him, even though she pleaded and begged to come see him.
Seeing these new moms have babies has been the hardest moment, along with having to breastfeed them, do their pumping for the new moms, and them not being able to be with their newborn children. It's hard to think of the family that they're missing.
Thinking about all the stories that these patients presented last night, it's like make you think about the virus does not affect just the elderly people. It also affects everybody. It affects an athlete, a strong person without any comorbidities. It can affect anybody. So it was kind of like you just have to pause and think about the spread is really in the community, and it can affect anybody in all walks of life.
The hardest thing in all of this has been taking care of fellow healthcare providers. It's really hits home, and it's really scary when you see someone that could be you coming in and now you're taking care of them. It's also hitting home that once healthcare providers start getting sick, who is going to be taking care of the public?
The hardest moment of my shift today, I was in charge, and we had a really sick patient that was in a really, really small room. And usually when we have sick crashing patients, we can have a ton of resources and a ton of staff go in and help with the nurse and the doctors that are taking care of that patient. But due to the patient being ruled out for the coronavirus, we could only have 5 or 6 people in the room at a time, and putting on all of the gowns and gloves and masks and face shields to protect us in case the patient does have coronavirus, it takes a while. So the nurse that was in there ended up being in the room for 6-7 hours with minimal breaks, and it was hard being in charge and knowing that she was stuck in the room and really nothing I could do to help her.
I think the hardest moment has been the fear that lives within all of us. There's a lot of unknown right now. We fear what's going to happen tomorrow, how the emergency department will look next week when we come in. We have fears about our own colleagues, whether they will fall ill. We also fear that we could be asymptomatic carriers and bring this virus home to our families and our loved ones. There's been a lot of fear over supplies and whether we'll run out. And then obviously there's a fear that we will see patients and not be able to do everything we normally can to help save patients' lives.
For me, the hardest moment was a young woman who died and her family wasn't able to be here with her.
The hardest moment during the shift was just seeing these COVID patients die helpless and without their family members beside them.
I'm used to treating sick patients. I treat sick patients all the time. It's very different knowing that the patient you're treating is actually a risk to you as well. That's the main difference here.
It's tough. It's tough to see families or patients with no families. You're the only source of human contact that they have.
Minoli Aya, the daughter of medical worker Matwi Aya, recounts her last heartbreaking memories of her mother who contracted and died of CCP virus while working on the front lines of this pandemic. Take a look.
Like, I always thought that I'd at least be married or I'd have a child before I lost my mom and my dad.
She just wasn't my mother. She was my best friend, and she was my confidant. She was like a sister to me, and I'm an only child, so having that mother figure in my life, or just having that sister figure in my life was a lot, meant a lot. And there was nothing that her hugs and her voice couldn't make me feel better. Everything about her just made me feel like I was safe and that I was at home. And she was just this amazing woman. She was my hero and she was other people's hero. And my dad likes to call her Super Mom because she really was. Yeah. She went to work, 12-hour shifts, 7 to 7, 6 to 6. And she'd wake up at 4 in the morning, and my room's right next to the shower. So I would hear her turn her shower on and I'd be like, yep, that's Mom. And then I'd go back to sleep. And before she left for work, she would kiss me on the forehead every day. And she said, I'll see you when I get home. So I was texting her back and forth a lot of time in the hospital, and I tried to call her and FaceTime, but she just was not weak. She was just not, strong enough to, speak or, to, actually talk. So I was like, okay, at least texting, it'll make up for, not being able to call. And her last text to me was Thursday. And I was just talking to her about college and stuff because I was doing college from home, and it was a weird adjustment. And I'm like, I need you home. I need to talk to you about so much. And she's like, I promise I'll come home and I love you. And that was the last time I ever talked to her. Even a few days after her passing, I kept texting her, wanting to believe that it wasn't true that she had passed away. And it's just hard because I never got to see her face. The last time I saw her face was January 21st, when I was at the airport leaving to go back to school. And it was just hard because, had I known that this would have happened, or, had I had just some clue, I would have told her to resign, or, to just stop working, or to, or just, I would have not gone back to school. And the thing is, I don't want her memory to go in vain, because I know that when all of this is over, and I hate to admit it, but the world will slowly start to become ignorant again, and they won't remember the people who, risk their lives for others. And, I see, on social media, and I see, on the news how, the fire departments and the police officers, and at 7 p.m. in New York City every day, they do a clapping and a cheering for the healthcare workers. But then I can't help but think, but what about the ones who are fallen? What about the ones who are already dead? I like to use the analogy, or I like to believe that doctors are our soldiers when it comes to fighting against these invisible little enemies, or these viruses. And you would never send a soldier into battle without any protection or ammo or guns. So then why are you sending our doctors into a battle with no protective gear to save them? And that's my entire thing. That she didn't deserve to pass away the way she did. That she deserved to live and see me graduate and become a doctor and get married and have kids. And, me and her always used to talk about Switzerland. Oh, we loved Switzerland to no end. That was a shared common interest between the both of us. And she, as a little girl, she wanted a house in Switzerland in the mountains. And, I had promised my mom when I was 16 that I would make that happen somewhere or the other, that she would get her house in Switzerland. And it just sucks because now, even though I plan on fulfilling that goal, I will never have my mother to see that. And, it's not fair the way she died. And it's not fair that she left me and my dad. And I just feel so lost without her.
In an exclusive interview with the Chinese language Epoch Times on March 30th, virology expert Dr. Dong Yu Hong pointed out that lifting the Hubei lockdown does not mean an end to the spreading of the CCP virus. In fact, the virus can lie dormant in those cured patients, turning the infection into a chronic disease. Take a look.
In an exclusive interview with the Chinese language Epoch Times on March 30th, virology expert Dr. Dong Yu Hong pointed out that lifting the Hubei lockdown does not mean an end to spreading of the CCP virus. In fact, the virus can lie dormant in those cured patients, turning the infection into a chronic disease. It may still attack and further destroy the person's immune system sometime later. These recovered patients and asymptomatic carriers can transmit the virus, and there are even super spreaders among them, she said.
When Hubei residents leave Hubei, they encounter difficulties everywhere, even though they have a health certificate and a stamped pass. Authorities in other regions still block them from entering or force them to quarantine. Why is this?
It is obvious that Chinese state media are spreading fake news and telling lies. They reported that there are 0 new cases of infection, but we know there are new cases emerging every day. At least in Hubei province, the epidemic is not under control at all. Even for those cured patients, the virus may still be in their bodies. In addition, there are asymptomatic carriers of the virus. Outsiders certainly want to stay away from people who come from Hubei. Let me tell you, this virus belongs to the type that cannot be eliminated from the human body. Instead, it stays in the human body and turns the disease into a chronic illness. When a patient is released, he probably doesn't exhibit any symptoms, but he can still transmit the virus to others. He can even be a super spreader. Although the lockdown has been lifted, people from Hubei will still encounter hostility in other areas for sure. That is the situation. Anyway, this virus is indeed very troublesome because it becomes a chronic disease. In addition, it severely destroys the patient's immune system. What does that mean? Take AIDS, for example. HIV virus may lie dormant for months or even as long as a year. Why? HIV attacks a person's immune system. When the immune system is deactivated, the HIV avoids elimination. The mechanism by which the CCP virus invades the immune system is similar to that of HIV. When it attenuates the immune system, the patient becomes a lifetime carrier of the virus. Based on what has been reported so far, for instance, the virus being contagious during the incubation period and those who relapse after being cured, these phenomena tell us that it is a chronic viral infection. That is to say, the virus hides itself really well. Some people may not experience obvious symptoms, but they nonetheless carry the virus for their entire lives. Those who are said to have been cured are not cured. It is just that the symptoms have been temporarily repressed.
It is also reported that the virus not only attacks the lungs, but also other organs.
It even attacks the brain and central nervous system. I am studying this subject now. There are cases of it attacking the brain, lungs, heart, gastrointestinal system, liver, and reproductive system. It basically attacks all parts of the human body.
Then why is it that some people are affected and some remain uninfected?
That is an interesting question. We may question every coronavirus patient about their beliefs. Do you believe in the Chinese Communist Party? Really? Don't laugh and don't take it as a joke. There is such a scientific research happening. That is, a person's state of mind is related to his physiologic state. If someone has immoral thoughts and believes in immoral doctrines, he will likely get infected and become a chronic patient. If I have a chance to do a clinical research on the coronavirus, I want to ask everyone such a question. Do you believe in the CCP? They may choose to answer anonymously, but I really want to know their answers. There was a recording released on the internet recently. Have you heard about it? A military doctor, actually a medical expert, gave an internal speech to military medics. The speaker, this military doctor, must have treated or studied patients on the front line. He said that after these patients are healed, their immunity is destroyed. There is a specific marker easily detectable in the blood that can tell us if one's immune system has been destroyed. He must have come to this conclusion based on this marker. He said that once someone gets the virus, his immunity will be weakened. The patient may recover, but his immunity will never be restored to a healthy level. He then warned everyone to stay at home and not go out, to avoid this virus as much as possible. He also recommended that people get an injection of thymosin and suggested some other methods to enhance immunity based on both Western medicine and traditional Chinese medicine. You can tell immediately that he must be a medical professional, as he is so knowledgeable on this topic.
Dr. Dong Yu-hom holds an MD from Beijing Medical University and a doctorate in infectious diseases from Beijing University. Dong has 17 years of experience in clinical treatment of infectious viral diseases and in antiviral drug research. Dong worked as a doctor in the first affiliated hospital of Beijing Medical University and then later as a medical scientific expert specialized in antiviral drug clinical research in Novartis R&D. She is currently a chief scientific officer for a Swiss biotech company.
On the lighter side, a 5-year-old boy from South Orange, New Jersey can be seen dressed as a Star Wars stormtrooper, dancing while family, friends, and neighbors cheer him on from a distance as he celebrates his birthday. It's probably one of the most creative birthday celebrations while social distancing. That was so cute and very creative of him and his family to celebrate such a wonderful day. A great story to end with. That's all for today. Don't forget to like, subscribe, but most of all, share this program with friends and family to keep them informed about the latest news and updates. Thank you for joining me. See you next time.